Wel, prynawn da unwaith eto, thank you for joining me today as we conclude the latest three-weekly review of coronavirus regulations in Wales. As usual, I want to start by setting out the latest public health circumstances in Wales. As you will see from this slide, rates of coronavirus in Wales have continued to fall since I last spoke to you 3 weeks ago. The all-Wales figure is now 14.7 cases per 100,000 of the population. When I was last here 3 weeks ago, that figure was 35. There are 14 local authorities with rates below 15 per 100,000 people. And the positivity rate is down to 1.7%. Wales has the lowest rates of coronavirus in the whole of the United Kingdom. Now, this continuing decline in coronavirus is the result of all the hard work which people across Wales have done. It is you who are keeping Wales safe, as restrictions have been relaxed, as children have gone back to school, and as shops and businesses have begun to trade once again. The pressure on our NHS is also continuing to ease, as the number of people needing hospital treatment for the virus has fallen to the lowest levels since mid-September. Indeed, the number of people in hospital for coronavirus-related reasons has more than halved in just the last 3 weeks. And this is partly because Wales also has the most successful vaccination programme in the whole of the UK. The very latest figures, which have just been published, show that more than 1.7 million adults aged 18 and over have had their first dose of the vaccine, and that's more than 2/3 of the adult population, and more than 650,000 adults have completed the 2-dose course, and that's 1 in 4 adults in Wales. And you can see that on the slide, demonstrating that consistent upward movement in vaccination numbers in Wales. This means that we're making really good progress in vaccinating younger adults. Around 2/3 of people in their 40s and more than 30% of people in their 30s have now had a first dose of vaccine in Wales. I want to say thank you and congratulations to all our fantastic vaccination staff and volunteers. Your work has been incredible, and it is that work that is making a real difference to the course of this awful virus. Now, because the public health situation remains positive, we have more headroom to make further changes to the current restrictions. Earlier this week, I confirmed that from tomorrow, 6 people from up to 6 different households will be able to meet outdoors. That rule of 6 will apply in private gardens and in outdoor hospitality settings, helping that sector to get back to business. Many cafes, restaurants, pubs and bars with outdoor areas are taking bookings ahead of the planned reopening from Monday. And it's been important that they have as much notice as possible about that rule of 6 so that they can take bookings from those larger groups. Today, I can also confirm that from Monday next, the 26th of April, wedding receptions and funeral wakes can be held outdoors at regulated premises for up to 30 people. Outdoor attractions, including fun fairs, theme parks and outdoor swimming pools, can reopen. Outdoor organised activities for up to 30 people will resume from Monday. And we have also updated our guidance on care home visits to allow for a second designated visitor to be able to see people, friends, relatives and so on, living in care homes. There'll be more flexibility around visits from younger children as well, and this updated guidance will come into effect from Monday of next week. Turning now to Monday the 3rd of May. From that date, gyms, leisure and fitness centres will be able to reopen for one-to-one training, personal training sessions, and now also for exercise classes for up to 15 people. From the 3rd of May, people will once again be able to form an extended household with one other household. Indoor supervised activities for children and indoor organised activities for up to 15 adults will be able to restart. And in order to allow that to happen, community centres will also be able to reopen. All of this means that by the 3rd of May, Wales will have completed or moved to alert level 3. The fact that we've been able to do this more quickly than had originally been expected reflects the progress we have made in controlling the virus and rolling out vaccination across Wales. Now, at the last 3-week review, as I do each time, I also set out a forward look of how the restrictions could continue to be lifted in the weeks beyond the current 3-week review. As ever, subject to the public health circumstances at the time. And it will be for an incoming Welsh Government to confirm these arrangements at the next 3-week review. That won't be held until the 13th of May, and that's a week after the election. It is my assessment, however, that the hospitality sector, bars, pubs, restaurants and cafes, should be able to open indoors from the 17th of May, together with all other tourist accommodation, indoor entertainment and attractions. And at the same time, I anticipate that we will also be able to increase the number of people who can attend organised events, including wedding receptions, moving to 30 people being able to take part indoors and 50 at outdoor events from the same date. But to be clear, these are choices and decisions for the next government to make. But in the usual way, I want the many thousands of businesses in these sectors to have these dates today, so they have as much notice as possible to plan ahead and to prepare. And as I've previously indicated, a further £200 million will immediately be available to that next government to support businesses which continue to be affected by the pandemic and by the restrictions. The changes we have introduced so far and the proposals I have laid out today bring us another big step closer to the lives we lived before this pandemic. Everyone wants the pandemic to be over so that we can all get on with our lives and work for a better future. But I have to say again today that the virus has not gone away. The signs in Wales are very encouraging, but elsewhere in Europe and further afield, there are worrying signs that remind us just how quickly this awful virus can alter course and spread again. And here in Wales, we are not immune to those continuing dangers. The dangers posed by the emergence of new variants of COVID-19 elsewhere in the world. So once again today, I ask for your help to help keep rates in Wales under control and as low as possible, because that gives us all the best possible chance of preventing new variants from emerging and managing any new outbreaks. If we continue to work together and follow the rules, we will keep Wales safe. Diolch o galon fel arfer I chi gyd. I will now take questions from journalists, and all the answers to these questions will be broadcast as usual, live on our social media channels. The first questions this afternoon come from Adrian Masters at ITV Wales.
Thank you, First Minister. Can you please explain why since you're bringing things forward because the rates are so low, why you aren't bringing forward the reopening of indoor hospitality to the same day as outdoor hospitality? Isn't there a risk that decision will create large crowds outside pubs, restaurants over the next 3 weeks?
Well, Adrian, we continue to take the same approach that we have taken throughout the pandemic. When we do a significant number of things on a day, we pause to make sure that the impact of those changes is not driving the virus up again. So you remember that on the 12th of April, we had a significant reopening with all children back in schools, all non-essential retail open, all close contact services able to operate again. And then we paused for 2 weeks until today to make sure that those changes weren't driving the numbers up again. Now we will have another significant set of easements today and on the 3rd of May. We then need to pause to make sure once again that that package of measures doesn't have unintended and adverse consequences. That has always been the advice of our Chief Medical Officer and Chief Scientific Advisors in Wales. You do something, you pause, you monitor, and provided things remain on track, you move to the next stage. That's why there is a gap of 2 weeks from the 3rd of May when we reopen a number of new parts of the Welsh economy and society. Provided all goes well, then we're confident that on the 17th of May, we'll be able to take that next move ahead.
And in that period from the 17th, which I appreciate the dates that or the sectors that you've included are indicative because you can't guarantee that you'll be making those decisions for that period. But in the list of easements you've mentioned, you make no mention of further extending household bubbles to anything more than the 2 households that you've already announced. Why is that? And can you give any guidance to people who want to think about being able to meet as an extended household anytime after the beginning of June?
Well, we are moving to recreate the sort of extended household we had earlier last year. 2 households will now be able to come together and form a single extended household, able to meet in each other's houses, stay overnight, all of those things. Once again, we then need to make sure that that isn't having unintended consequences. The advice and the evidence has been clear now for a long time that meeting indoors is amongst the most risky things we do. We want households, of course, to be able to do that, and 2 households will now be able to operate in that way. What we will do is review the evidence of that. And provided that is going well, then of course we will look to extend that so that further households can be added into that arrangement so that more family members can meet in ways that we would once have taken for granted. But we won't do it until we are sure that the public health evidence and the context of the time means that it is safe for that to take place. Adrian, thank you very much. I'll go over to Hugh Thomas at BBC Wales.
Diolch, Prif Weinidog. COVID-19 is expected to circulate in the population for years to come. Based on the scientific modelling that you've seen, what do you think now is the earliest point at which you would be prepared to end the requirements to wear masks and to maintain social distancing if we have to live with this? Could that come this year? And could you answer in Welsh as well as English, please?
Hugh, thank you. Well, I think it's very difficult to anticipate right through to the end of this year. The UK government has a group working on the whole issues of social distancing and the things that we've all got used to doing to help protect each other. And it may be that there will be some easements of that over the months ahead. But I'm afraid I think you're right, that we're going to be living with coronavirus for a very long time. And I think people are going to want to go on taking those simple steps which help to keep themselves and others safe. So I don't think it's sensible for me to try and peer into the looking glass right to the end of this year. If things continue to improve as they have in Wales, we may be able to mitigate some of the measures that we are all taking. But I think that the population in Wales, which has stuck so carefully to the rules and done so much to protect one another, they will want to go on playing their part, rather than thinking that we can act as though coronavirus has gone away, because it won't have done. Wel, jyst i ddweud, mae'n anodd I fi I edrych tan diwedd y flwyddyn hon. Ond ni'n gweithio gyda'r Llywodraeth y Deyrnas Unedig I weld os mae unrhyw beth ni yn gallu feddwl I wneud I llacio rai o cyfyngiadau personol ni gyd yn wneud golchi dwylo, defnyddio mygawdau ac yn y blaen. Ond yn fy mhrofiad I, dwi'n meddwl mae bobl yma yng Nghymru sydd wedi wneud pethau mor galed â gilydd I helpu I warchod bobl yma yng Nghymru. Bydd pobl yn eisiau bwrw ymlaen I wneud y pethau syml ni'n gallu wneud pan mae nhw'n helpu ni I gyd I cadw ni a bobl eraill yn ddiogel yma yng Nghymru.
Diolch. One of the awful legacies of the pandemic is the impact that it's had on treating other conditions. We saw yesterday that the waiting lists are now longer than ever, and the head of the NHS in Wales has previously said it could take 5 years to get on top of that. But if you are in government after the election, what sort of reduction, percentage terms, can you commit to reducing those waiting lists in that first year in government?
Well, Hugh, thank you. It's very important for me not to stray into the election. I'm here as the First Minister reporting on coronavirus matters. So I'll simply say what we've said previously as a government. As you said, the head of the NHS has said that repairing the impact on the NHS of coronavirus will be the work of a full Cynhadledd term. In the budget that the Cynhadledd passed for the current financial year, so going through to the end of March next year, there is £1 billion as a down payment on what will be necessary over a 5-year term to make that happen. And any government coming into power after the 6th of May will face that challenge, and I'm quite sure that whoever is doing this job will want to do it in a way that protects our NHS, recognises the very severe impact on the workforce that the last 12 months has had, and to find a way of restoring NHS activity and all the other things we look to the NHS to do as quickly as that can be organised here in Wales. Hugh, thank you very much. Over to Dan Bevan at LBC Wales.
Thank you very much, First Minister. You've previously given us dates which have been brought forward, first of all in the last review and now in this one as well. That would indicate that we are on a good path into the summer. So do you think we are in for a better summer than we had last year? And what restrictions, if any, do you expect to be in place while the case rates remain so low?
Well, Dan, I do think we're in for a better summer. I remember saying here some months ago now, when I was being asked to look forward and asked about my ambitions for dealing with coronavirus, I said what I hoped we would be able to do would be to lift restrictions earlier in the year than we were able to do last year, and for them to last longer over the summer. So some of the things that I've announced today, indoor hospitality, the reopening of the whole of tourism accommodation and so on, we were doing that well into the summer last year, and we'll be doing it in May, I hope, this year. So we are certainly further ahead than we were 12 months ago. This will still be carried out under the coronavirus regulations. So when we talk about the reopening of indoor hospitality, it'll be 4 people who'll be able to meet together. When we talk about the reopening of outdoor activities. It'll be for a limited number of people. Coronavirus has not gone away in Wales. And while I think we can all look forward to a summer that is a lot better than the winter we've all just had to live through, it's very important for me to continue to explain today that that does not mean that coronavirus is no longer a threat to us here in Wales, and that we can afford to behave in ways that puts us at risk.
Thank you. But picking up on one detail in particular there, because you mentioned indoor hospitality, of course, that's got a restart date now. But with cases being as low as they are and vaccination programme having as many people vaccinated as currently is it not time to have another look at social distancing? Because plenty of businesses won't be able to reopen indoors because of that particular measure. And once the money that eventually will dry up that is available at the moment, because they will be able to open by law, but of course they simply won't be able to do it profitably. So is that something that you're considering to take a look at?
Well, absolutely. We continue to look at the social distancing measures all the time. I said earlier that we are engaged in a UK exercise to look at all of that. The rules we have for hospitality in Wales are indeed that there should be a 2-metre distance, but where venues are not able to operate in that way, that doesn't mean that they can't open at all. It's that they have to have additional mitigating measures in place to compensate for the fact that a 2-metre distance cannot always be achieved. And I really want to pay tribute to the sector itself, who worked so hard last year to make sure that those mitigating measures were in place, who now have the timetable they need to be able to go back, learn as we all need to from the experience of last year, put in place the things we know that worked, add additional measures where we've learnt from the experience of coronavirus and what has happened elsewhere, and to make a success of things. To make a success of things as businesses, but particularly to make a success of things so that we don't end up seeing what nobody wants to see, coronavirus catching fire again, and us having to face the sorts of blunt actions we had to take earlier at the end of last year. By working together, by making sure that we put everything we can in place, then we have the best possible chance of avoiding that. Dan, thank you very much. Over to Branwen Jones at S4C.
Diolch, a prynhawn da, Prif Weinidog. Allwch chi egluro'r rhesymeg tu ôl I lacio cyfyngiadau fydd yn caniatáu hyd at 15 o bobl I wneud ymarfer corff dan do, yn gynharach na gadael I 6 o bobl archebu bwrdd tu fewn I fwyty?
Wel, diolch, Branwen. Wel, mae nifer o resymau tu ôl hynny, a mae'n dibynnu ar pethau mae pobl yn wneud a faint o amser maen nhw'n wario pan maen nhw yn dan do. So, pan mae pobl yn dod dy gilydd I bwyta, maen nhw'n wyneb a wyneb dy gilydd, a maen nhw'n yna am sbel, yna dyn nhw. Pan mae bobl yn mynd tu fewn I ymarfer corff, enghraifft, mae lot o pethau yna I le I helpu I delio gyda'r risg sy'n dal I fod yma, ond hefyd mae bobl ddim yna am amser hir hefyd. So mae lot o pethau fel yna tu ôl ffigurau. So Branwen was asking me for what lies behind the reason why 6 people are able to meet for certain purposes in certain places, and then 15 people are able to meet indoors for other purposes. And I was explaining that there are a number of reasons that lie behind that. It is partly to do with how people are positioned with one another, how people face each other and so on, but also the length of time that people spend. So the longer you spend together, the smaller the numbers need to be to keep people safe. Whereas if people go to exercise, for example, they're unlikely to be at that venue for that length of time. They're not likely to be as close as you would be if you were a group of friends spending time together, and therefore the numbers that you can allow safely to be in those settings varies according to those sorts of factors.
Diolch, Prif Weinidog. Gan fod India bellach ar restr goch teithio, beth yw'r diweddaraf am yr amrywiolyn India yng Nghymru ac a yw hyn yn achos pryder i chi?
Wel, mae nifer o bobl ti wedi dod yn ôl i'r Adain Senedig yn wedi teithio i fewn i Gymru achos maen nhw'n byw yng Nghymru. Mae 8 o bobl ni'n gwybod amdano ar hyn o bryd yng Nghymru gyda'r variant newydd sydd wedi dod ni wedi weld yn India, ond mae'r pobl lleol sy'n gweithio yn y maes iechyd y cyhoedd, maen nhw'n gwybod amdani nhw i gyd, ni'n gwybod maen nhw'n gwneud popeth ni'n eisiau nhw i wneud i cydymffurfio gyda'r reoliadau ac y cyngor dwi wedi gael yw does dim rhaid i ni becso amdani nhw achos mae pobl lleol yn delio gyda'r achosion ni wedi weld. Am fy marn ni, mae'n pwysig mae India nawr ar y restr goch ac ni'n gwneud popeth ni'n gallu wneud yn y maes i delio gyda'r unrhyw effaith mae hwnna'n gael arno ni yng Nghymru. Branwen was asking me about the number of people who may be in Wales with the new variant of coronavirus that we've seen in Wales and how that is being the new variant that we've seen in India and how that's being dealt with in Wales. So I explained that we have 8 cases we know of in Wales of people who have returned to the United Kingdom from India and whose homes are in Wales. But all those cases are known to local public health teams. All of those individuals have been individually contacted and are being individually assisted to make sure that they themselves are kept well and that they don't pose any risks to others. And the advice I have had is that because it is being very well managed locally, there's no cause for wider public health concern in Wales. I just went on to say that I think it's very important that India is on the red list and that every action is taken to make sure that we are properly defended against the re-importation into Wales of new variants that we can see beginning to emerge in other parts of the world. Branwen, diolch yn fawr. Over to Adam Hale at PA.
Prif. You've said the reopening things earlier than was planned is due to the headroom created in recent weeks and nothing to do with the election. Can you detail exactly what has surprised you with Wales' progress since you last addressed the country?
Let me just highlight 2 things if I could, Adam. When I last spoke at this podium, as I said, there were 35 people per 100,000 in Wales suffering from coronavirus, and that was good progress. But it was progress that was quite slow. It was always in the right direction, but it was coming down point by point. I think the fact that it has more than halved in the last 6 weeks is faster than we would have anticipated back then. So that's one thing which I think has allowed us to bring some restrictions, the end to some restrictions forward, because the fall in prevalence has been a bit quicker than it was in the 3 weeks previously. And then secondly, it's the rate at which we are seeing the impact on our hospital sector reduce. 3 weeks ago when I was here, there were 615 people in Welsh hospitals with a coronavirus-related condition. This morning, that's 287. So again, it's well more than halved in just 3 weeks. And we are seeing, we believe, and this is preliminary of course, we're seeing the signs that vaccination is reducing the number of people coming in through the front door of the hospital. And that's another reason why we are able to bring some of the end of those restrictions forward, because the impact on our health service, which we've been so concerned about during the whole of the pandemic, is clearly lessening and continue to lessen.
Professor Sarah Walker, the Chief Investigator with the National COVID Survey, reported to have said today that Britain has now moved from a pandemic to an endemic situation. Do you recognise that view and agree that the coronavirus pandemic is over by its definition?
Well, by its definition, we are no longer at this moment in a pandemic. I continue, as I feel I must to just sound a warning sign that this is not a one-way street. The fact that things are getting better does not mean that it inevitably goes on getting better. We've seen, just in recent weeks, how fast things went from being in a good position to a very difficult position in France, in Italy, in Germany. Now, of course, we are working very hard to make sure that the current progress is not reversed in Wales. But there's no guarantee that unless we go on doing things carefully, cautiously, step by step, and with the help of the whole of the Welsh population, that is bound to be the position. If we were in a position that this was an endemic condition, that too doesn't mean that there's nothing more for us to do. If coronavirus is an endemic condition like flu, we may still need to see, for example, a vaccination program in the autumn of this year to make sure that those who had it at the beginning of the program get a booster and that we take account of new variants occurring elsewhere in the world. So an endemic disease is still a disease, and it will still require action by government, by the health service, and each one of us in our own lives to make sure that that endemic condition doesn't become one that loses lives and puts services at risk. Adam, diolch yn fawr. To Will Hayward at Wales Online.
Thank you, First Minister. I'd like to ask you more about masks, if I may. Last summer, you have been constantly questioned about why the public in Wales were not being made to wear masks in shops or public transport. You quite reasonably argued that there was not much point as cases were so low, and then you introduced mask wearing as cases increased. Given that cases are now so low again, can you explain when people will not have to wear masks in shops or public transport? Is there a certain level of cases that we need to get to? People may not understand why they're still being asked to wear masks when rates are so low when you were so reluctant to bring the rule in last year.
Well, we will continue to get advice from our Chief Medical Officer about the point at which mask wearing in crowded public places or public places where people have to spend a considerable period of time, the right moment at which that could be raised. At the moment, the advice is that it should remain part of the repertoire of things that we all do to protect one another. So I returned from North Wales to South Wales yesterday on a train journey of about 3.5 hours. People were very respectful of the rules. People were wearing masks because you're in that space with other people, not just for 5 minutes, but for an extended period of time. At the moment, the advice is that it is still a useful part of the defences that we have to keep one another safe, but you can be sure that it is kept very regularly under review. And when the Chief Medical Officer says to me that he believes it's no longer something that needs to be required, then that would be reflected in the decision making that would then follow from that advice.
So you can envisage a scenario where mandatory mask wearing would stop this summer. And can I just ask you what you think, whether a third wave is still inevitable in Wales? And even if it does happen, will it be a totally different scenario from the first two? And what does the current modelling suggest about the realistic worst case scenario?
The latest modelling does suggest that there will be a third wave in Wales. That it would not be of the same magnitude as the waves we saw over the winter and back in the spring of last year, provided we go on doing things in the way that we have in Wales, not opening too many things in one go, not doing things too quickly, pausing to make sure that we review the impact of the things that we do. If you build all of that into the model at the moment says there will be a third wave with the advantage of vaccination, which we didn't have back in the winter or back last year. The impact of such a wave should not be such that we would require the blunt instrument of lockdown to deal with it. That its impact on the health service would be manageable. But that the big ifs in that, are the ones I've just said. That we continue to do things in a measured way, and that as a population we continue to do the things in our own lives that help to keep one another safe. If we can do that, then the chances of a third wave being manageable in a very different way to the last two will certainly increase.
So mask wearing possibly ending this summer? Is that
honestly, it isn't for me to second guess what the Chief Medical Officer will say. What I can say is that I know that he keeps this issue under very careful review. As things get better, if there is a possibility that it is no longer a required part of the repertoire, then he will give me that advice. But I can't just pluck a date, I think, out of the air without having that advice in front of me.
Thank you.
But thank you, Will. Over to Nathan Shoesmith at The Spectator. At The Speaker, rather.
Thank you, First Minister. Good afternoon. While high, the uptake of the vaccine by priority group 6, the clinical risk groups aged 16 to 64 years old, is lower than some of the other later priority groups at around 84%. Are you aware of any reasons for this, and is work being done to encourage increases in take-up to the highest possible levels in this priority group and the other top 9 priority groups where most people have now been vaccinated?
Yes, look, I think the answer is probably reasonably straightforward, which is that while all the other categories, you can tightly define them in advance. If you say you're going to offer vaccination to everybody over 80, then we have a pretty precise figure of the number of people in the Welsh population who are aged over 80. When you're talking about the priority group 6, which includes informal carers and other people with conditions that are not quite so tightly defined, it's harder to be sure you know the number that you are aiming to achieve. And so we in Wales deliberately set out to take, what's the right word? I'm probably not giving the right word in saying a generous view of the number of people who should be included in that category. But I was clear, and Vaughan Gethin, the Health Minister, was clear with our officials that we didn't want anybody to be left out who was entitled to be vaccinated. So we've got quite a big target number, and it may be that when we finally review it all, there are fewer people in that category than we originally envisaged. In the meantime, it's very important. I'm very grateful, actually, for the chance to say again this afternoon, we want nobody in Wales to be left behind for the opportunity of vaccination. And if there are people who think they may be entitled in that group, they should still come forward. If someone has decided not to take the vaccine, but now thinks, seeing the numbers and the effect, that they'd like to be vaccinated, it's never too late to be vaccinated here in Wales. And that certainly includes people in that category 6 group.
Thank you. We know Wales's 7-day case rate is the lowest of any nation in the UK by some way. However, some restrictions are tighter than in other parts of the UK. How closely have you been communicating with the UK government and the other devolved administrations regarding their restrictions, their experience of easing restrictions, and has that played any role in your plans to ease restrictions further?
Well, pleased to be able to say, as I've said a number of times here recently, that communication on a 4-nation basis has been better since Christmas than it was before. We generally have a weekly meeting chaired by Michael Gove, the Minister in charge of the Cabinet Office. Because of elections, that's not been quite as regular over the last few weeks, but it will resume, I know, next week. That is an opportunity to share information and to make sure we all know what one another are doing. Of course, the Welsh Government takes into account what is happening elsewhere. Our population is very close to the borders. We've rehearsed many times here, and what happens across the border has an impact on us. But taking things into account is what we do. We're not driven by what somebody else decides. We make our decisions on what is best for Wales. And the fact that we have done things in the way we have, that careful, cautious, step-by-step approach, I believe, is the reason why we have the lowest prevalence of coronavirus of any UK nation. and I want to go on doing things in that way in order to continue to keep the population of Wales safe.
Thank you.
Nathan, thank you. To Andrew Nuttall at the Leader.
Thank you, Minister. I was just wondering if you would be able to provide us with an update on the recent outbreak that was confirmed at the Cape Crew Bakery in the Bala region of North Wales. Just sort of saying what this sort of shows for that we can never be too careful, as you were saying before.
Absolutely, Andrew, thank you very much. Well, as some people will know, that a large workplace cluster of about 48 confirmed cases was confirmed at the Cake Crew factory in Bala. It's a factory that draws employees from several other local authorities around North Wales and also from Powys and from Shropshire. The first case was identified at the start of this month, and there has been additional testing put in place to make sure that anyone who may be suffering from coronavirus, including people who are asymptomatic, can be quickly identified. There is an interdisciplinary team of people, as we would normally have, led by public health consultants, established, and it met yesterday, the 22nd of April. There will be an on-site mobile testing unit there from Saturday, from tomorrow, and arrangements are in place for twice weekly testing of asymptomatic employees from next week. Everything I have seen says to me that the actions that need to be taken are being taken, that the workforce, the employer and the public authorities are jointly engaged in making sure that the outbreak is managed and brought to an end as quickly as it can be.
Thank you. And we were also hoping to get your view on another situation in North Wales. As you'll know, you were in Wrexham yesterday. You will probably have heard of the incident at the Wrexham Mala Hospital, where there was an incident of a hoax call which saw the hospital put on lockdown and people were turned away from appointments that day. And what is your sort of take on this? People were missing appointments and an already strained NHS as well. This is not going to have gone down well.
Well, the information that I received while I was in Wrexham, Adam, that it was a credible threat. Now, you know that threats are made and public authorities have to make an assessment of the threat, and not every threat is responded to by stopping activity and closing appointments. The reason why it happened is that the authorities involved believed that this might have been something genuine. And to be honest, while I understand the frustration of people who were turning up for appointments, I'd rather be standing here today explaining why that was thought necessary than standing here saying that an incident had happened and people had been injured and no action had been taken. So it's a very fine and difficult judgment for people on the ground. You know, is this one to be taken seriously compared to another one that you might think wasn't credible? Yesterday, those involved believed there was something behind it. And therefore, in order to protect people, protect staff, protect people turning up for appointments, those actions were taken. As soon as it was safe to do so, the hospital reopened and appointments began again. And I'm sure that the hospital authorities will be looking to contact people whose appointments were missed and get those rescheduled as soon as they can be. Thank you very much. Andrew, over finally for today to Joe Strong at Atrium Live.
Thank you very much, First Minister. So students are back in university now, but things are still restricted. We can only have 5 in a class at the same time. And when the hospitality venues reopen, it'll be the same. What needs to happen for these restrictions to be eased or lifted?
Well, what needs to be happened, I think, is 2 things. First of all, and most importantly, the public health context needs to continue to be good and as much as possible to improve. And the second thing that needs to happen is that we need to carefully review the new things that will become available in Wales in the rest of this month and into next month, and provided they can be instituted successfully, then we'll be able to move on and to lift those restrictions further. So it's the general context has to stay good, and then the particular things that can reopen, we need to be sure that that is being done successfully, and then we'll be able to continue down the road that we've now been on Wales for many weeks, where week by week things continue to get better.
Thank you. And we have spoken to one festival organiser who says that the Welsh Government has discriminated against the live music industry and not offered enough financial support. Will there ever be a detailed roadmap out of restrictions for live music, as looking ahead in 3-week segments does not always give organisers enough time to prepare?
Well, I'm afraid it's the virus rather than the Welsh Government that has the impact on that industry. And look, I've got every sense of sympathy with people who try to organise live music events, festivals and so on. They have been very, very badly affected in the last 12 months. But we have, as I said when I was here 3 weeks ago, a programme of pilot events now in Wales that will happen in May and at the start of June. We are connected to the pilots that are happening across the border in England. We are looking all the time for ways in which those parts of our normal lives can resume again. I'm looking forward very much to when I can go and watch Glamorgan play cricket rather than following the score on my phone as I do every day. And we'll be in that position before long, where we'll have pilot events that will allow people to be at sports, arts and festival activities. Well, we know that we've got a formula that will allow those things to reopen further, successfully from a business point of view, safely from a point of view of the health of the public, then of course that's exactly what we will want to do. But I'm not going to do for the festival sector what I've not felt able to do for any other sector, and that is to pluck dates out of the air many weeks ahead of now and pretend that I or anybody else can offer that sort of certainty. Unfortunately, coronavirus isn't an experience of that sort, but we will work closely with the sector during the pilots with the aim of restoring that activity safely and successfully in Wales as soon as we're able to do so. Joe, thank you very much indeed. Thanks to everybody. That's the end for today.